Our exploration takes us to the medieval hospital, the art of medicine.
To take it on the most macro level, of course, the notion of the Middle Ages in general as a dark age or as a benighted age certainly doesn't apply when we look at the history of medicine or even really the history of culture. Probably the last word you might think of applying to the Middle Ages is innovative, but it is extremely innovative, looking for all kinds of new ways of thinking about things, new ways of handling knowledge, new ways of understanding it, new ways of trying to tie it all together into one sort of large unified field theory. It's a huge, vibrant period in the history of knowledge, learning, and culture. Thanks to the Crusades, thanks to other forms of cultural transmission, the West in the 11th and 12th century was absorbing huge amounts of knowledge and innovation from countries in the Middle East, a huge amount of Arabic knowledge, which was not only original native knowledge, but also was really the means of transmission of classical Greek knowledge about medicine and philosophy in particular. This made a huge impression both on the theory and practice of medicine. More specifically, one medical misconception that I think it's really important to deconstruct is this notion that dissection and interest in anatomy didn't exist or didn't take place during the Middle Ages. In fact, people were very interested in the notion of dissection. While they tended to use animals more than humans, the idea of human dissection was not itself necessarily strictly prohibited. And especially in terms of the bodies of criminals and saints, they seem to be two groups of people for which dissection was allowed and a great way to get some actual practical knowledge about how the human body worked. One important thing to remember about hospitals in the Middle Ages and Renaissance is that their primary function wasn't medical. The function of hospitals was really to provide shelter for people who had various kinds of social needs. Sometimes specialized ones, as in the case of orphanages. They served as shelters for pilgrims, so a way, in a sense, for people to be able to get food, drink, and shelter as really, in some ways, the way we would think of charitable institutions is really closer to what a medieval and Renaissance hospital would have been like. Well, you certainly wouldn't have the expectations of privacy that you might expect now. For those who went for surgery and medical treatments and the kinds of things that we associate traditionally with hospitals, it would be a pretty surprising experience compared to what we do. We sort of feel that we're a bit second class if we have to share a room with somebody. But in medieval and Renaissance hospitals, you were more likely to share a bed with somebody or even have 3 or 4 patients to a bed. And it depends on the hospital. One thing that, for example, if you went to the Hospital of Santa Maria Nuova in Florence in the late 15th century, you had about an 80% chance of coming out alive, which is a lot higher than you would necessarily expect. So that's one thing that you could certainly look forward to. Physicians would have had formal medical school training, and barber surgeons might have benefited from this in a kind of informal and indirect way. But since physicians belonged to the guild, in fact, it was the guilds of doctors and apothecaries, so it was really the physicians and the pharmacists who, in a sense, were lumped together in that same guild. Their guild membership required a certain level of training and a certain level of formal training at the great medical schools, Bologna, of course, being probably the primary example in Europe of a good, large medical skill, where ideally you would send somebody to get a prestigious education in medicine. One thing that's very characteristic of medicine in the Middle Ages and medicine in the Renaissance is there are very two distinct groups. The physicians were considered to be, in a sense, the theoreticians of medicine. They had done all of their reading of Hippocrates and Galen. They were expected to keep up on all of the medical literature. And they would be brought in really more as consultants. The same way in law, some lawyers might be brought in just to give specific advice on a case, and then they would leave. For routine things, barber surgeons would be sort of the everyday person who would administer the medical care. There's one example I can remember where barber surgeons were employed by the institution to shave and cut our children, which presumably meant not only for bleeding, but also for minor surgeries and things that needed to be done. The same person who cut their hair could also do at least some of the more minimally invasive surgical procedures.